This week is Research and Innovation Week here at Children's National, and we're taking the opportunity to interview some of the leaders in health science and public health. And today we have with us Dr. Kelly Gebo. She's the Dean of the Milken Institute GW School of Public Health. She gave us a great presentation about leadership in public health this morning. The first question I have for you is, what is, do you think, the biggest challenge facing public health in the current era in the United States?
There's a lot of things that we're facing with headwinds in politics that we haven't had to face before in terms of attacks on higher education, public health, academic medical centers. And I think that some of the things that we also are tackling are regarding misinformation and why the public doesn't trust science in the way that it previously had.
Yeah, that really is, it's funny, it strikes everything that we do, and it's so critical in medicine, public health, because human lives are at stake. So that very much resonates. But like you, I'm also an optimist, and I like to lead with optimism because I actually truly feel it. We all have to be flexible and adjust to meet the needs of the day. So I'm going to ask you the question is, what are you most optimistic about in the next 5 or 10 years, specifically about public health, but health science in general?
I'm very excited about it. I think there's many things for us to think about the future with optimism. The technology changes that have happened in terms of medicine in the past 10 years have been revolutionary, with AI and gene therapies and lots of technology that we didn't have previously. Healthcare has changed dramatically, and the health outcomes of the populations we care for have improved significantly. I'm also excited about our future learners. We have lots of opportunity with students who are excited about public health and want to make a change moving forward. And I can't imagine where things are going to be in the next 20 years with these really optimistic, motivated students and the new technologies that we have to think about for them to lead change.
What's the best way that we take these novelties that we will be developing in public health science and health science in general and deliver them to the communities most at need?
It's a great question, because improving health outcomes for all is really what we try to do, and trying to address populations where they are, identifying what their needs are and really engaging with them at their community level, I think is the way we're going to optimize things. So if we sit in our ivory towers and hypothesize what people or communities need, we're not going to be doing what actually is needed. And so getting out into the communities, developing relationships and partnerships with our organizations, with our communities, with the groups we are trying to treat and improve outcomes for, I think is really what we're going to be able to identify. What are their needs and how do we best address them?
Thank you so much, Dr. Gebo, for joining us today in the Lead in Peds Unplugged. And for our listeners out there, I hope you enjoyed this brief session with Dr. Gebo. And please, for our full sessions, download the Lead in Peds wherever you download your podcasts. Thank you so much.